For many men over 60, there's a silent conversation happening about changes in energy, drive, or how your body responds in private moments. You might dismiss it as just age, feeling embarrassed or worried. But what if some private habits could be quietly working against your prostate health, sexual vitality, and overall well being? This isn't about shame or judgment. It's about empowering you with knowledge to protect your health and preserve your vitality for years to come. If you're a man over 60 who wants to take control of his health, you are in the right place. Stay with me because today we're pulling back the curtain on the 7 masturbation mistakes after 60 that are silently harming older men. Before we begin, if you're serious about taking ownership of your health, comment vitality down below, like this video, and subscribe to the channel. Hello, gentlemen. My name is Dr. Evelyn Hart, and I am a urologist specializing in men's health for over 15 years. Let me be very clear, the changes you are experiencing are normal, but suffering in silence is not. Your sexual health is an integral part of your overall health, and it deserves the same attention you'd give to your heart or your blood pressure. The topic of self-pleasure is often shrouded in secrecy and myth, especially for older men. Today, we're going to talk openly, honestly, and medically about common missteps, so you can make informed, healthy choices for your body. Mistake 1, ignoring the prostate connection. Gentlemen, you cannot have a conversation about male sexual health after 60 without talking about the prostate. This walnut-sized gland is central to your reproductive and urinary health. A common mistake is approaching self-pleasure with the same intensity and goal-oriented focus you might have had in your youth. This can lead to a pattern of forceful, straining orgasms. Why is this a problem? It can cause what we call prostatic congestion, a buildup of fluid and pressure that can exacerbate symptoms of an already enlarged prostate, BPH, leading to more frequent urination, a weaker stream, or a feeling of incomplete emptying. The healthy approach is to focus on the journey, not just the destination. Gentle, rhythmic stimulation that allows for a natural, less strained release is far healthier for your prostate. Think of it not as a race, but as a mindful practice that respects your body's current needs. This leads us directly to our second mistake. Mistake 2, rushing the process and creating performance anxiety, even with yourself. In your younger years, speed and efficiency might have been the goal, but now rushing can create a silent cycle of anxiety. When you rush, you might not achieve a full, satisfying erection or orgasm. This can be misinterpreted as failure or dysfunction, creating performance anxiety that you then carry into partnered sex. You start worrying, and worry is the enemy of arousal. Worry activates your fight or flight response, counteracting the rest and digest system needed for sexual function. The healthy approach is to give yourself permission to take your time. Create a relaxed private environment. Use this as a time for self-exploration and sensual discovery, not a task to be completed. This reduces internal pressure and can actually lead to more pleasurable and reliable responses. Now, let's talk about a physical issue that is incredibly common but rarely discussed. Mistake 3, neglecting your pelvic floor. You've probably heard women talk about Kegel exercises, but this is critically important for men too. Your pelvic floor is a group of muscles that act as a hammock, supporting your bladder, bowels, and sexual function. A weak pelvic floor can lead to urinary incontinence, while a too tight one can cause pain and difficulty ejaculating. The healthy approach is to learn how to both strengthen and relax these muscles. To find them, try stopping your urine flow midstream. The muscles you clench are your pelvic floor. Practice contracting them for a few seconds, then fully releasing them. This awareness of clenching and, more importantly, releasing can make a world of difference in your sexual health. Our next mistake is one of lubrication, or rather, the lack thereof. Mistake 4, skipping lubrication, or using the wrong kind. Age-related skin changes mean the penile skin becomes thinner and more delicate. Engaging in friction without adequate lubrication is a direct recipe for microtears, irritation, and a condition called balanitis, inflammation of the glands. This is not only uncomfortable, but can also increase the risk of infection. Furthermore, many men make the error of using products not designed for this purpose, like soap or lotions, which can disrupt the natural pH and cause further irritation. The healthy approach is simple. Always use a high-quality, water-based or silicone-based personal lubricant. It reduces friction, protects your sensitive skin, and enhances sensation, making the entire experience more comfortable and pleasurable. Let's address a mistake rooted in unrealistic expectations. Mistake 5, comparing your 60-plus body to your 30-year-old body. This is a psychological trap. Your body is different now. Erections may not be as rock hard or as quick to arrive. The volume of your ejaculate will likely decrease. The refractory period, the time before you can become aroused again, will likely lengthen. This is normal physiology, driven by natural declines in testosterone and other age-related changes. The healthy approach is to embrace your body as it is now. Focus on the pleasure and connection you can feel, not on recreating the sensations of decades past. This shift in mindset from comparison to acceptance is one of the most powerful things you can do for your sexual well-being. Our sixth mistake involves a crucial aspect of health that goes far beyond the bedroom. Mistake 6. Using it as a barometer for overall health and ignoring signals. Self-pleasure can be a useful, though not definitive, gauge of your general health. If you notice a sudden, significant change, like a persistent loss of erection, painful ejaculation, or blood in your semen, it is a mistake to dismiss it as just getting older. These can be important warning signs of underlying conditions like cardiovascular disease, diabetes, hormonal imbalances, or in the case of blood, prostate issues that need medical evaluation. The healthy approach is to be a good detective of your own body. Pay attention to these signals. Don't panic, but don't ignore them either. A sudden change warrants a conversation with your doctor or a urologist. It's not an admission of weakness, it's an act of strength and responsibility. Finally, we come to a mistake of balance. Mistake 7, falling into a routine of isolation. While self-pleasure is a normal and healthy part of life, it's important to view it within the broader context of your life and relationships. If it becomes a solitary habit that completely replaces intimacy with a partner or leads to social withdrawal, it can have negative effects on your mental and emotional health. Humans are wired for connection. The healthy approach is to see self-pleasure as one component of your sexual health, not the entirety of it. If you have a partner, consider how open communication about your needs and desires can enhance your shared intimacy. Nurture all forms of connection in your life, emotional, intellectual, and physical. Gentlemen, we've covered a lot of ground today, from prostate health to pelvic floor, from lubricant to mindset. Your health is your responsibility, but you do not have to manage it alone. My goal was to empower you with knowledge. First, take this information and have a frank conversation with your healthcare provider at your next checkup. Be the man who breaks the silence. Your doctor has heard it all, and your health is worth that conversation. Second, if you found this video helpful, if it made you think, or if it gave you a spark of hope, please pay it forward. Like this video, share it with a friend who might benefit, and subscribe to this channel. We are committed to bringing you honest, expert advice to help you live your strongest, healthiest life. Finally, I want to hear from you. What was your most surprising takeaway? Or what health topic would you like us to cover next? Thank you for trusting me with this important part of your life. Remember, taking ownership of your health is the most powerful step you can take. Stay vital, gentlemen.